welcome you to America's Roundtable, a weekend program from the nation's capital focusing on the economy, liberty, and security. I am Joel Anand Samy, joined by co-host Natasha, Srdoc, an economist and former contributor to the Economist Intelligence Unit, Becky Norton Dunlop, Vice President at the Heritage Foundation and former Director of the Ronald Reagan White House Cabinet. It was just a week ago that our fellow Americans heard about the U.S. Supreme Court's ruling, whereby the nation's highest court upheld the Affordable Health Care Act, the health care bill pushed by President Obama. Becky Norton Dunlop, what is your thought on the framework of our discussion today and in regard to liberty?
The decision to uphold what we call Obamacare, because it's Obama's creation and Nancy Pelosi and Harry Reid put it through the House and Senate, and turns it over to nameless, faceless bureaucrats in Washington, D.C., who make decisions really without regard to the choices that a patient and the patient's family might want to make. So liberty lost in a very severe way with this court decision, and that's liberty for each individual American.
It is really interesting, Becky and Natasha, that this past week, the Pew Research Center poll offered these findings. It says the public has long been divided in its opinions about the 2010 health care law. But one thing that was interesting, it said, despite extensive public interest in the court's ruling, just 55% of the public knows that the Supreme Court upheld most of the health care law's provisions. 45% say that either the court rejected most of the provisions, and 15% do not know what the court did. To help us shed light and bring clarity to the Supreme Court's ruling and present his views on Obamacare, we welcome our special guest, Dr. Bob Moffit, Senior Fellow at the Center for Policy Innovation at the Heritage Foundation in Washington, D.C. Welcome, Bob. What was your initial reaction when you heard of this news just a week ago?
Well, I can say that I was profoundly disappointed. I think that when the oral arguments were finished in March, a lot of us who had followed this very closely felt that we were on the verge of a major victory. So it's profoundly disappointing. What this is going to mean, however, in order to get rid of Obamacare, we're going to have to do it the old-fashioned way. We're going to have to elect new leaders who are going to affirm their commitment to overturn this monstrous piece of legislation. It doesn't get any more intrusive than government interference in your personal life in terms of your actual the preservation of your health and your relationship with medical professionals. I'm not surprised that the public is confused about it. The truth of the matter is the people who enacted it did not even know what they were doing when they enacted it.
Now, Bob, who is going to bear the increased costs of health care?
Well, a lot of folks out there think that, their employer buys them their health insurance or the government provides it for them. The employer and government officials are basically the channels through which taxpayers' money or premium dollars flow. The truth is 100% of health care costs are borne by households. So everybody listening to this program is going to pay for what this law will require them to pay for. There's no getting away from that. The real danger here is that the economic incentives that are built into this law, that are hardwired into this law, will mean that millions of Americans who have health insurance coverage that they have today and that they like will in fact not be able to keep it. Most of the promises the president has made with regard to his own signature legislation are not going to be kept. And there's very few, if any, independent analysts outside of the White House who think that any of these things are true. In the case of health insurance plans, millions of Americans are going to lose their health insurance coverage. In terms of premiums, there's not one independent analyst who thinks that premiums are going to decline. In terms of overall health care spending, in every single category, health care spending under the Affordable Care Act, under Obamacare, will increase. And the taxpayers are going to be faced with over $500 billion in new taxes. And now that the Supreme Court has ruled that the penalty was not a penalty after all, but a tax, it means that we're going to have another major tax imposed on millions of Americans that they did not think was coming.
What options do we have as American citizens?
Well, I think right now you're looking at the presidential candidate, Mitt Romney, has affirmed that he has promised that he's going to repeal Obamacare. The House of Representatives on July 11th is going to once again put a repeal bill before the House. That will go to the Senate. The question there is whether, in fact, there will be any votes in the Senate. I would just remind your listeners that last time it was pretty close, 51 to 47 in the Senate. So it's not a situation where it's a lopsided victory in the Senate for Obamacare. However, truthfully, what has to be done here is the Congress has got to use all of the authority at its disposal to block Obamacare, and that means cutting off the appropriations, cutting off the funding, defunding regulatory initiatives. That there's certainly enormous resources that they have to basically change a lot of what is taking place. They have already blocked certain provisions of Obamacare, and they can block the others. I do not think for one moment that this law will remain on the books. Certainly it will not remain on the books unless it's radically altered.
Currently, only 1/10 of Americans buy insurance for themselves. In Switzerland, everyone buys insurance for himself. So individuals are in control of the cost. Switzerland achieved low government health spending in completely privately managed healthcare. They have access to the latest technology, low wait times for appointments and procedures, no employer-sponsored or government-run insurance programs, and insurance prices are very transparent to the beneficiaries. There are 100 different private insurance companies, so there's quite a lot of competition, which is bringing prices down. And insurance also cover pre-existing conditions, and they interestingly operate as non-profit entities. Government spending on the healthcare in Switzerland is 2.7% of GDP, compared to the USA's 7.4% of GDP in 2008. If U.S. would come closer to a Swiss model of lower spending of GDP, it would be able to save some $700 billion a year. What are your thoughts about it, Bob?
Most of the European countries, basically the government runs the healthcare system more or less. In Switzerland, you have something, though, that is very unusual. You mentioned the relatively low level of government financing. Healthcare spending in the United States, about half of it is government spending. So basically, half of all of the spending in the United States on healthcare is either Medicare, Medicaid, the state children's health insurance program, various public health programs. And the private sector in the United States is contracting, which, by the way, is going to be accelerated with the continuation of the Affordable Care Act. So there is a dramatic difference in the role of government in terms of financing. And it is also true, as you point out, that what happens in Switzerland is something that does not happen to a large extent in the United States. Swiss citizens can pick and choose the kind of health care plans they want. The plans are involved in intense competition with each other to deliver high-quality care. And Swiss citizens can fire those plans if they don't perform. I would mention, though, one more thing about the Swiss model. Many conservative analysts who looked at it say, yes, the financing is terrific, but the regulatory system is far more extensive than most of us who are in favor of a free market in healthcare would be willing to tolerate.
We have different stakeholders, and the lobbying will start as we speak. So we have conflicting, actually, interests of hospital owners that want to renegotiate the $155 billion in healthcare payment cuts that they agreed to during negotiations of the law. Insurance companies want more leeway to charge older people higher rates than younger ones. Drug makers want to increase what Medicare pays for medicine. Patients, of course, want quality healthcare at low cost. How do we reconcile all these different interests?
Well, the answer is we don't. I mean, it's pretty simple. That's not going to happen. When the bill was passed, you had the initial analyses, the independent analyses by the Congressional Budget Office and also the Medicare actuary. They were looking at the Medicare cuts in particular, the reductions in payments for hospitals, home health agencies, hospice care even, in order to finance, by the way, all of these Medicare cuts were being used to finance other entitlement expansions that are in the bill. So money is being taken out of Medicare to finance the federal tax subsidies that to create another entitlement. But what they pointed out is that this is politically unsustainable. It's not going to work. You are not going to cut $575 billion out of the Medicare program without a level of kicking and screaming like you've never heard before. These are record-breaking cuts. And one of the reasons why most of us feel that the achievement of deficit reduction that the administration has been claiming is that there's no way that they are going to be able to do that. It is also a fact that the deficit estimates for the Affordable Care Act are based on current law governing physician payment. Well, in 2013, physicians are facing, under current law, almost 31% payment reduction. This is not going to happen. We are not going to cut doctors by 31%. But the administration's claims for deficit reduction are based on these nonsensical assumptions. Right now, in the next 15 years, we're going to be facing a shortage of about 150,000 physicians, primarily in the area of primary care. And the bad news for those of us who are 65 and older, Medicare, geriatricians, people to take care of the elderly. 150,000 physician shortage. That's what we're looking at. And another 15 million people being added to Medicare. This is the perfect storm for a healthcare crisis in the United States. Now, what will happen is that a lot of physicians will simply not take new Medicare patients. It's not that they're going to drop the current ones, but they're not going to take the new ones. The problem is that the Medicare population is going to jump over the next 20 years from roughly 50 million people to over 80 million people. That's the problem. Well, in fact, you have to hand it to the Congressional Budget Office. They're being very straight with us. They say that if we continue the current policies, by 2037, federal debt will equal 200% of the GDP of the United States. In other words, we're going to have twice the size of our own economy in debt. Your point about spending, the crazy spending, I mean, right now, as most of your listeners probably know, we're basically borrowing 40 cents out of every dollar we spend in the United States. This is the path to madness. We have an awful lot of things we have to get under control, but one thing that we must get under control right away is the creation of a new and potentially disastrous entitlement program that is going to basically pour more gasoline on the fiscal fire. We've got to get this fixed.
What would be the ideal healthcare reform? How do we best protect individual liberty?
Economists have been debating this for the past 35 years. There is no serious debate on a couple of obvious facts. Number one, the health insurance markets are not competitive. The fact of the matter is the president was absolutely correct when he went before the American people and he said that these markets in many states are dominated by 2 or 3 big giant insurers, and people's choices are in fact limited. And when you have a limitation of supply and demand remains the same, costs go up. We have got to make health insurance markets competitive. Now, there are 2 things you've got to be able to do to make that happen. One is people in the United States have got to be able to pick and choose the health insurance coverage that they want, whether it is through their employer or outside of the place of work, but they've got to do it without facing a dramatic tax or regulatory penalty. Right now, nobody listening to this program who is in employer-based health insurance or in many of the dysfunctional health insurance markets in the United States can actually do that. You can get health insurance in the United States outside of the place of work, but if you don't have any tax relief to offset the cost of it, for most middle-class families listening to this program, it's not affordable. It's just simply not. You can, of course, there are pockets where you're able to get affordable coverage. Health savings accounts is one example of a real serious breakthrough in health policy where people are able to get a program that has lower premiums and at the same time gives you more control of your health care dollars through a savings account. But outside of that, we still have a structural problem with our health insurance markets. So 2 things have to be done. One is we have to create an environment that is truly competitive, which means that if I live in New York City, but I want to buy a health insurance plan in Indiana, just like I buy any other good or service, I should be able to do that. That's number one, to force health insurance companies to compete. The second thing is to say, all right, fine. If you decide to buy a health insurance plan that you think is best for you, you should be able to get direct tax relief for that, regardless of where you get it, whether you get it from your employer or whether you buy it from a trade association or you get it from a church-sponsored institution, whatever it is, you should be able to do that. We have got to level the playing field for insurance, and we've got to empower individuals. You do those two things, and then you will do something else. Once patients are empowered and they control the dollars, the relationship between the patient and the doctor changes. That's critical. Doctors right now are on the receiving end of a lot of third-party decisions they don't like. But if the patient is in control of the dollars and the key decisions, that means the doctor is now empowered like never before. All of these things are possible, but it requires a fundamental repeal of Obamacare and a replacement with a brand new system based on patient empowerment and, as Becky pointed out, personal liberty.
Well, Bob has just laid out two, what I think are fairly simple and well understood by the average American, points that can be adopted tomorrow by a House and a Senate and signed by a president who really are interested in the freedom of people to make their own personal choices and for repairing some of the problems in our healthcare system. So those are two things that your listeners, Joel, can talk about, they can think about, they can talk to their neighbors and their churches and their employers as options for replacing this abomination that we call Obamacare.
Becky, you were mentioning something about the U.S. Constitution and the importance of Americans returning, reading, understanding that very powerful document from our founding fathers.
Yes, and thank you for bringing that up. We really need to remind ourselves and our listeners that we have a beautiful vision for our country called the Declaration of Independence. It would be useful for every citizen to take it out and read it at least once a year. 4th of July is a good time to do that, but it can be done more often than that. Then the rules of the road, so to speak. If you're going to have this vision, what is the kind of government that you should have in place that limits the power of government over the people? And that is what our Constitution does. It basically says that the national government's primary responsibility is to make us a secure and safe people. In other words, protect us from the enemies without and within our nation. Then allow us to be free to go about making decisions for our own families like health care. So, Joel, I'd like to make an offer to your listeners if they will contact the station on which they're hearing this program and leave their name and the fact that they heard about this on your show and an address that we can mail them a pocket Constitution. I'd be delighted to offer that service.
This is America's Roundtable. We'll be right back.